Hello friends, me Dr. Rachna Gora Gandhi and Dr. Yusuf Gadiali are going to teach you the way we operate any kind of a skin tag, mole in our clinic, and it is a minimal invasive, rather it takes hardly any minutes, and the best part is it's an advanced technology in Ayurveda. I will just show what we are doing is our preparations. See, this is the machine with we are going to use. Basically, this is Agni Karma according to Ayurveda and a very advanced technology of cauterization. This, if in case required, then we may use, one second. If in case required, we may use xylocaine, that's 2%, ointment 2%, 5% in some cases.
To make the procedure painless.
Yes, so it becomes painless and minimal bleeding happens during this procedure. I'll just show the tag what we are going to cut right now live. These are the few tags and he has some more. See, even at neck. So right now on live we are going to cut all this thing with minimum invasive. Now Dr. Yusuf is going to explain about the same.
Yes, good morning friends. This is a patient of ours who has no other comorbidities or no other parameters. All investigations have been done, like pre-surgical, the basic ones have all been tested. Which way he faces bleeding time, clotting time, and those routine parameters of HIV, triple H, and all the parameters are fine. The CBC counts and all have been tested. So now we are taking him for a minor skin tag removal procedure, which is very simple, non-painful, you can say, minimal invasive, and it gives you very good results. The reasons for these tags, which just Dr. Rachna showed you on the screen, is that sometimes your skin immunity is on a lower side, or your profession is such where you get lots of sweating. Like he's a gentleman, he is a professional instructor, so where he gets lots of sweating throughout the day. So that is a reason where these moles or tags get a formation. They become a breeding ground for small skin viruses and they lead into formation of such. There is always liver function sometimes is a concern, or your lipid profiles are disturbed. That leads to formation and deposits of these skin tags. So we correct the lifestyles, we correct the liver disorders, we correct the lipids, and then externally which is formed is by the Agni Karma and the cautery combined together. In a very beautiful way, we get rid of it. So to just elicit the things, I'll just identify my targeted areas, like what I'm going to target. These are the targeted areas on this particular site. Now to get the things ready, I'll first just anesthetize, like clean up the place with spirit. This is just a routine clinical spirit, but to make it easy, the spirit is a potent skin cleaner, so my marked places have gone amiss. That's okay, we will remark it, but cleaning the surface is a basic hygiene procedure. Marker. Fine. That's not really be comfortable keeping a hand up this way. If you are not comfortable, you can lie down. This will take a little few seconds. So first just go with application of local xylocaine gel. Dr. Rasha, can you help me load the xylocaine in the intradermal syringe? Initially I have just applied local xylocaine gel 2% to make the skin anesthetized, so there is no sensation even of the minute intradermal needle prick which I'm going to give. You need a big needle. There we go. Perfect. Just minute, tiny.
Only this much is
I've
required.
just taken a small tiny needle which is an intradermal diabetic needle, diabetic insulin administrating needle, and I've applied xylocaine pre-hand, and now just a small cotton plug. I have applied xylocaine 2% locally to the skin, and this particular big tag at the pedicel, the base of it, I am injecting it. Rather than just get a small tiny prick. Can you feel the prick?
Yeah.
Very good. Is it painful?
No.
Now the second prick will be non-painful. Now almost the thing is desensitized, and it is very easy for us to just get rid of it. Now I'm on a cautery machine and I need mopping. That's if it is at all painful, just let me know. You'll be ready with the mop. Painful है? जरा भी पेन हुआ तो तुरंत बोलिए. पेन होगा तो तुरंत बोलिए. So we have very easily removed the largest possible skin tag very safely, effectively. The xylocaine which we used was having adrenaline, so there is no bleeding at all, luckily. Now sir, I need a mosquito forceps. आप अच्छी लाओ. I need a mosquito forceps. Yes. And I will need you. Is this painful? Perfect. If at all it pains, just let me know, please.
थोड़ा सा.
I need the injectable. We have put a little amount of xylocaine again over here to make it non-painful. Even this time I didn't ask the patient regarding before injecting the xylocaine. This is such a tiny needle. Scissors. Of course, yes. Now over here we have a spot of a speck of a blood. Now we take the cautery. Now we give the electrode. Now comes in picture our
You just have to hold this in your another.
that's perfect. Now we bring in picture our Vidhagni Yantra, the RF cautery machine combined together. So what's the reason? Now if you see, this has gone out so well, it just needs a dressing. But it has been seen these skin tags, these moles, these warts have a tendency to regrow. They come back again. Once we remove them surgically, like just xylocaine injectable and excising it, they have a tendency to regrow. Now giving you this Vidhagni Once we cauterize the place, we burn the place, we do the agnikam, the classical text agnikam. So deep inside, all the tissues, the reminiscent viral material or the skin infected material is taken care of. So that it doesn't have any chance of recurring at the same place again. So now we'll just go with a small tiny procedure of giving it a small. Any pain or discomfort, sir? Now the difference between these two buttons are, I first give the agnikam deep inside, and then whatever minimalistic bleed is arrested by a cautery. So now if you see over here on this particular excised part, I'll first give you a basic agnikam, that is a deep inside heat. Now you see, just by doing this much, the area is almost scarred and there is no bleed as such, and still we cauterize it and it's taken care of. Now, there is no bleed at all, zero bleed, and it's very smoothly fine removed. Agnikam is done. And now good enough Ayurvedic herbs, ointments will take care of it and give you a beautiful healing, and the skin will become totally clear. And now I'll take care of these small tiny specks too. Directly burnt.
All different types can be shown.
And give me a mosquito. I hope at the end of the day, Raj, the patient, will be a happy person. ये तो ना कि ना आने आ रहा आमा ना कि उसको कुछ लोड करो not be able to. That's it. Just a tiny speck, hardly 0.1 ml or maybe less than that, and now it goes out very smoothly. Mosquito. What's that? Yes, got it. Perfect. Is it painful, sir?
No.
This being a very tiny speck, so we directly got rid of it with the cutter, the cautery of our Agnikar machine, the Vidagni. So if you may be able to appreciate the tiny speck, it was earlier, but once we have removed it, it has a good enough big pedicel which is deep seated. This was a tiny one. Okay. Now again we'll give it a burn. Just one small tiny one, and then cauterize it to arrest any further bleeding throughout the day. This is a quite tiny one without a pedicel, which is just in a growing phase. So you will just give it a Agnikar. Perfect. Just by Agnikar, this tiny speck is totally vanished now. It's no longer there. Yeah, it is. Dr. Raja, can you just help our viewers appreciate the tiny
Yes,
speck,
sure.
which was a very tiny. So we didn't inject with xylocaine, nor did we use any scissors. It was just couple of touches by the Vidhavni probe, and now it is totally gone. Here it is. The earlier photos would be appreciable. Just couple of touches and the skin is like gone. We gave a good enough Agnikarm followed by cautery, and it's way nice to go.
So basically, depending on the size of the tag, the line of treatment was a bit different. In some cases, it was cut. In some case, we burnt. In some case, it was cut and burnt. Both.
Correct. Now we're just cleaning up the place, mopping it up again, getting rid of the leftover marker as well as sanitizing the place, cleaning the place, and putting a small dressing. That's it.
See, can you see the difference? Now we'll be doing the same other part. Now there will be,
Just to get the patient comfortable, just dress this up.
yeah. So we'll be applying an ointment
Ayurvedic ointment.
yeah, which heals it completely. You can keep your
You
hand
just
down
pass.
for a second if you want.
That's a
Might be
really
paining. How was your experience?
one second.
Is it
लग रहा है
painful?
हाँ हाँ और पेन भी नहीं हुआ
नहीं हुआ है
नहीं,
पेन
बिल्कुल नहीं।
ठीक है
Sure. We'll just apply aloe vera based gel just to keep the area cool and soothed. Ideally, we can leave the area open also. No dressing or covering is required. But as it being an axilla area, like this is a place where you sweat a lot. So just for today, we'll put a simple just packing about this aloe vera gel and put a very simple, easy tape. This is a simple, easy dressing which can stay till today evening. There may be a little minimalistic 0.1% chance that there will be a little discomfort or burning sensation, which will be minimalistic. If there is just a paracetamol 500 mg just for one single day is fine. The way we take it post vaccine, Dolo 650. Just a small paracetamol single dose is fine. So I suppose this side is quite comfortable. I hope nothing was fine. Now we move towards the other end. Yes. I want to make him lie down.
yes
Yeah, so he'll be more comfortable.
yes
What we want dress head over, na?
yeah
Perfect. Very nice.
one second
Perfect. Yes, that's it.
okay right
Yes. थोड़ा भाग की तरफ. Very good.
ज़्यादा कंफर्टेबल
Ah. It is a live procedure, so we are also learning by the live. Because usually we do this in our Panchkarma room, but just to make the things more viable and feasible for our viewers, we are using a consulting room. So here we have identified 3 specs. Sir, help me with that, okay? So again, we'll just put a little spirit for the skin hygiene, getting the skin cleared. एक needle ले लो ना fresh.
you can use this till that time it is there 0.5
अच्छा 20 मिनट हाँ नहीं नानी वाली हाँ so we again this being a little bigger pedicel at the base of it we are just injecting a small amount of this will burn off just by the cautery. Perfect. Now as the xylocaine has taken effect, we'll just go for the excision. Is there any pain? Just let me know. Very beautifully the skin tag is removed, and you all the viewers can appreciate there was not a single drop of blood. A minimalistic one. Here it is. It has been gone clearly, completely from the base. There it is. Now apply the xylocaine for this particular one. Very good. I had free hand now.
I will just have to hold this, huh?
Perfect. That is the
Just
electrode
hold
just to
this,
complete the circuit.
yeah.
To complete the circuit of the. This is the way you just mop it, and now we'll cauterize it. Here comes our RF machine probe again. This is we are giving the Agnicon first, and I need a proper mop.
Yeah.
This mop there for me. You just mop it and give a good nice Agnicon. One more, and it's fine to go. Now we may cauterize it using the second one. That's it. Now this particular one, we had just applied local xylocaine, and just burning it off is all it needs. This you may be getting some sensation, just a minute sensation. That's it. The patient was quite anxious in the previous day. I had to do a little counseling. Holier now is going to be very painless. And today, unexpectedly, he is doing very fine. Usually we expect patients jerking or moving a bit around. But maybe by his profession and study built up, and here it is. Just by couple of impulses by the probe of the RF cautery with Dhagni machine, and this skin tag is way off. Totally smooth. There is no eruption or anything. The previous one has been totally cauterized, no bleed, totally clean. This is the burn mark. We had specifically burnt it. This is superficial skin. The aloe vera gel will take care of it and further ointments, and the skin becomes scarless, painless, bleedless, and scarless. So now we approach the last one. Here we take help of little mosquito forceps to get a better hold. We have already injected a minute quantity of xylocaine to this, so the thing is painless, and here we go rid of it. Here we are excising it with the cautery itself, so we get the Agnicon effect simultaneously, and here is the minute skin tag, which becomes a cosmetic concern. Yeah, the worrisome skin mole, skin tag. Now the reminiscence area will be given as impulse of burn so that it doesn't come back again, and just a touch of cautery. See, when I'm using a different cautery probe, you can see a little fumes that it is cauterizing the vessels, so there is no further bleed throughout the day. This one was a quite good one, quite happy. So now again we'll go with the dressing. We'll clean the place with spirit. Mop it. Give it few seconds so the additional extra spirit vaporizes, the extra additional spirit vaporizes, and here is our aloe vera gel, cooling, soothing and healing. Silver is again a good potent healing agent as per Ayurveda, Rajat. So we can use a bit of Rajat silver in colloidal form and make a gel base out of it for our patients. Now some is tiny dressing. Now last thing is left is the neck. Just cut it with this one. Muscle vessel. Simple, easy procedure. Going slow today, being a Sunday, no rush, and as well purposefully on request of Dr. Rachna going slow so that our viewers can appreciate it more. Perfect. Yes, any pain, movement, difficulty?
Yes.
Perfect. Now let's move around with the last one over the neck. Yes. These tiny ones we'll take directly by the cautery machine, just by a touch of it, and these will be taken care of. And this tiny pedicel may need a slight injectable. What nails can you get next time. In the meantime, we are applying just the xylocaine ointment to desensitize the place. Normal low protein xylocaine. These integrities are being shared specifically for our medico friends as well. Ideally, it's not in the purview of the patient to know which gel or what. It's a medico's work. So I've just applied the xylocaine gel and we'll leave it up for a few minutes. See. इसका नीले फूट के साथ यार वहाँ पे नहीं इसके नीचे है यार चलो you please come here and need a proper patient
5%.
yeah, that's okay I'll get 2%. So now
One more thing I would like to show.
just cleaning up the excess, make the area non-sticky so the probes get better fixation over the area. All you need is peace, dexterity of the hand, and patience. Rope. Pass. 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 Sit. These look tiny, but cosmetically they are quite troublesome for the patient's psyche. And anyways, no one would like to have these outgrowths hanging around him. This time we are going without the injectable xylocaine, because this is intermediate, not quite big, not quite small. We have fixed the thing with the mosquito and going right to the base, and off it goes. That's it, done. Here it is. The big mole is quite better, gone from the pedicel area. Very nice. Now the few tiny ones which need a little touch would be this one. Few of our batchmates are here. They can even smell the cautery which is burning the skin. Yes. See, this particular mole is quite, the tag is gone. This is quite evident, gone. This one, the big one, without injectable, just the local xylocaine has done the work. So in short, patients need to build up confidence that this procedure is literally, we can say, harmless, painless, done by a dexterous person, and it's quite fine. We'll just let this thing evaporate. Give it a good, nice clean with a sterile mop. And way to go, it's clean. All the skin tags, moles, warts, the small ones which were evident earlier, are all clear. This is such a simple process and safe that if required, we may give just a local antibiotic applicant later on day 2. But the best part is we can skip the oral intake of antibiotics. It is such a safe and easy procedure. We definitely keep our observation on the patient, but the process is very nice. I think I'll have to give a little cautery over here, this one. And the reason you can see this particular point has a little pedicel left, and we don't want it to regrow and come back again. That's it. Here's the cotton machine is closed now. And also the spirits.
You can give that.
Throat. Yes. Yes.
One second.
Yes.
Yes, thank you.
Perfect. So just put a small simple dressing out here of aloe vera based gel. So good enough skin tags, moles have been taken care of. So we use a couple of sterile gauze pieces. These are simple dressings which can be easily removed at home by the patient by the evening. Or after any pain, discomfort, or any difficulty you feel anywhere, do please let us know. It's a great support and help of Dr. Rachna backhand, without which was very difficult to undertake this procedure. Yes, doctor, please take over. Rachna, now you can slowly turn over and sit slowly, comfortably. Just say something to our viewers, just wave.
And you can just speak about your experience. कैसा लगा आपको? दुखा बहुत कि क्या एक्सपेक्ट किया था और क्या है?
हाँ, मुझे लगा था कि शायद ये पेनफुल रहेगा, लेकिन बिल्कुल पेन नहीं था और एकदम इजीली हो गया है। तो मैं दोनों डॉक्टर्स को थैंक्स बोलना चाहूँगा, डॉक्टर यूसुफ एंड डॉक्टर रचना, दोनों को थैंक यू बोलना चाहूँगा। बहुत अच्छे वे में हो गया मुझे डर था लेकिन बहुत अच्छे से हो गया, बहुत इजीली हो गया, बहुत शॉर्ट टाइम में हो गया। तो थैंक यू एंड थैंक यू शरय आयुर्वेदा।